Good evening, everyone. Dear ladies and gentlemen, my dear colleagues, our esteemed guest faculty, Dr. Ramesh Bijlani, all other faculty members, my dear friends. So, today I welcome you all for our seventh online module of Self Empowerment Program. This is our presidential program of Indian Fertility Society from the center. And this program is dedicated to empower and rediscover oneself. So, in this series, we have a very interesting talk today by Dr. Ramesh Bijlani. Sir himself is not only a renowned medical doctor, but also a spiritual speaker. So, till now, for centuries together, we all have been conditioned to seek answers of our problems from outside. But we need to understand that the greatest healer, the greatest doctor is actually within us. So, the topic of today's talk is very interesting and very apt. The talk is The Doctor is In. So, today we embark on a journey of self discovery, a journey that will empower you to take charge of your health, your well being, and your life. So, for this program, we have support from our IFS President, Dr. Pankaj Talwar, our Secretary, Dr. Shweta Mittal. We are thankful to them. And now I take the privilege of inviting Dr. Bharti Dhore Patil, Madam. Himanshu, can we have CV of Madam, please? Yeah, Madam, she is a IVF consultant at Pune and heading many research committees. And she has also received many star awards. Pune Women Icon. She has been inspiring gynecologist. But not only this, she's a very spiritual person, which is another aspect of Madam. She follows ISKCON regulations. She has got spiritual degree Bhakti Shastri from Bhakti Vedant Spiritual Vidyapeeth. She is also a preacher of Bhagavad Gita. Madam, we would like to listen to your message for our listeners. Dr. Bharti, please.
Leena, and good evening, all dear colleagues, friends, our guest speaker today, Dr. Ramesh Bijlani, and all listeners who have been there for this interesting program, which is actually a brainchild of Dr. Pankaj Talwar and Dr. Leena. Uh, we empower everybody. So why not? We should know ourselves. How can we take over our own things? And that's how we started exploring the new areas, new uh, speakers or faculties, which will give us a different aspects to see your own self. So we have to believe in ourselves, not by the external factors. That actually requires a practice. It is not so easy. And today we are going to see this by Dr. Ramesh Bijlani, how he is going to tell us. We have till today six modules completed. This is the seventh module. And we have a very interesting, different, ways to understand. And every talk, if Dr. Leena will agree with me, we ourselves enrich with something else. So, and that's very interesting. Every talk we look forward what different things we can explore in ourselves. We thank Dr. Pankaj Talwar, President, to actually initiate this and to make us a part of this program. Dr. Shweta Mittal, as a secretary, aptly supported this program. And Dr. Leena is very sincerely seeking different modules, different times. So thank you so much, one in all, and we welcome Professor Ramesh Bijlani. And I would like to request Dr. Leena now to introduce officially Professor Ramesh Bijlani, our guest speaker today, uh, about his curriculum and how he's been till here. So,
Yeah.
Dr. Leena, please.
Yeah, thank you, madam. So I would like to invite Professor Ramesh Bijlani for his talk, and I would like to introduce himself. Sir is a medical doctor, scientist, educationist, writer, inspirational speaker, and a spiritual seeker. So, sir, I came to know about him from one of my colleagues, Dr. Mankul, and it was nice to connect to Dr. Ramesh Bijlani. And I'm very thankful that he immediately accepted our invite. Sir has been ex-professor and head of Department of Physiology at AIMS New Delhi. And he has done his master's degree in nutrition from MIT, USA. And a very interesting part, especially he has done 25 years, he has dedicated on research on nutrition in relation to chronic diseases. And a turning point in his life was his first visit to Aurobindo Ashram, which he's associated with since 1992. His personal and professional life converged when he established at AIMS in 2000 the Integral Health Clinic for providing lifestyle modification courses based on yoga in tune with the recent advances in mind body medicine. He has a lot of publications and PubMed to his credit, many articles on spiritual networking site you will find on Speaking Tree, more than 30 books on variety of subjects including yoga and spirituality. And also he has written books for the children. And especially, he is heading the online learning platform. Yes, which stands from yoga, education, and spirituality. This was his brainchild, which he initiated in 2021. And the YouTube channel linked to the project has more than 600 videos, collection of 70 videos which are related to scientific medicine. So if you go through it, you will find a seamless blend of modern medicine, Ayurveda, yoga, and specialty. This is something very unique of Professor Ramesh Bijlani, sir. And sir, we are looking forward to hear from you something different, very apt topic which you have chosen. The doctor is in. So I welcome you, sir, and the platform is now yours. Thank you, sir.
Thank you, Dr. Leena Wadhwa, for a very generous introduction. And finding persons like Dr. Bharti here, I feel very much at home that this is not a typical gathering of doctors who are trained only in scientific medicine and are, if not hostile, at least somewhat indifferent to spirituality. So this is a platform where I feel very much home at. And Dr. Rajvi, of course, from the Iyengar School of Yoga makes me feel even more at home. Uh, I haven't known her much, but all the same, once in a while we have seen each other at meetings related to yoga. So I feel very much at home on this platform. When I was given this topic by organization of medical people, and the theme was self-empowerment, I assumed who has to be empowered and empowered to do what. I assumed that it is people who have to be empowered, and they have to be empowered to take care of their health, stay healthy, and if they fall ill, to recover from an illness by taking charge of their own health and wellness, which means that there's a lot that they can do on their own. They should feel empowered that we can do it ourselves. Now, this is something which is disappearing partly because of the advances in modern medicine. Because even if I look back around 75 years ago, when I was a small child, if I got fever, and all children get fever repeatedly in childhood, uh, we did go to a doctor. He did give some sort of a mixture. Probably the mixture had some salicylate, an antipyretic, and along with that, some dietary advice. And if the fever goes up, then you keep a piece of wet cloth on the forehead and so on. So all that was done. But the person recovered. I recovered from that fever in a week or so. And now that we look back at those measures which were used, none of them was doing anything directly to the germ that might have caused the infection, which was responsible for the fever, which means the body could deal with that germ. The body was empowered to do it. And then, but then gradually, we have developed more and more of a dependence on uh, medical interventions as the advances have taken place. But all the same, the body still remains the hero. Even when we give an antibiotic to treat an infection, the very last germ is actually taken care of by the immune system of the body. So without that, one will not be able to recover from infections, and that's what used to happen, at least till recently, in patients with AIDS. We had all the antibiotics available, but then uh, the person still kept getting recurrent infections, and sooner or later succumbed to one of them because the immune system was weak. So with this little introduction, I'll now share the screen. And before I go any further, the love and blessings of the Mother and Shri Aurobindo to all of you from Shri Aurobindo Ashram, Delhi branch. So the topic is the doctor is in. And this might remind you of those old-fashioned nameplates on the doors where you could just slide it. If you slide it this way, then it will be out. And if you slide it this way, you can see in. So the doctor is in. The idea is that the doctor is within you. Now, this is a picture of my granddaughter. And we live a long distance away, so talk only on the phone. So one day she told me that she has some rash on the skin. Then after a few days, when we talked on the phone, I asked her, how is the rash? She said, it's all right. So I told her, how did it become all right? She said, I applied some ointment or cream. So then I told her, suppose you had not applied that ointment, then what would have happened? She thought a bit and then said, maybe still it would have got all right, but maybe it took a little longer. So I was surprised that even the child had that innate sense that it's not that the ointment healed her, although that was the first response, that it became all right because I applied something. But then she realized that if I didn't apply, maybe still it would have recovered. So that self-healing capacity is there and we have that innate sense. But gradually, as we get older, we become more and more dependent on outside intervention. And to understand that, let's have a quick look at the recent history of modern medicine. We find that modern medicine made spectacular advances during a relatively short period of 50 years, starting with the 20th century from 1900 to 1950. It was during this short period that the germs which were responsible for disease were discovered. It was during this short period that the vaccines and antibiotics which could deal with those infections came up. And it was during this period that we discovered the vitamins. And therefore, now vitamin deficiencies like pellagra and beriberi, which used to kill people earlier, now they need not kill because we could pack these vitamins in a pill and give the person, and the person was cured. And it was during this period that we discovered insulin, and the clinical picture of diabetes changed dramatically. And it was during this period that the anesthesia became safe, and therefore major surgery could be performed safely. And it was during this period that imaging techniques and biochemical tests made advances which made diagnosis very accurate. Now, the result of all this was that the countries which could benefit the most from these advances experienced a remarkable increase in life expectancy. Life expectancy there was only around 30 to 40 years. If you read the classical novels of authors like Charles Dickens or Jane Austen, you find that the characters start dying at the age of 30, 35, and very few live beyond the age of 50. So that was the life expectancy. But then by 1950, in the Western countries, the life expectancy had risen to about 80 years. And history has repeated itself in India. When we became independent in 1947, the life expectancy was in the 30s, and now it is more than 70 years. So that is very good. But then the that did not mean that people became immortal. People started dying of a new set of diseases. And these new set of diseases were different and required a different approach. And we'll see how that actually facilitated the uh, return of our appreciation of self-healing mechanisms. Now, as a result of these spectacular advances, what happened was recovery also to the body, because the mechanisms within the body were now known with great accuracy and uh, remarkable detail. And this depth and detail so hypnotized us, and the advances which we made, which led to the increase in life expectancy, led to such a euphoria that we thought if we understand the body a little better, then we'll be able uh, that it was like trying to understand everything about the bulb by dissecting the bulb. What we forgot was that without the electricity, the bulb is not of much use. So we just focused on the structure which we could see under the electron microscope, and the various biochemical mechanisms which were worked out in great detail. And we thought an understanding of the body in scientific terms will give us more and more power over health and disease. But then, as I said, there was a humbling experience that we started seeing, and this is one of the stories which you will find interesting. This person, Norman Cousins, who was not a doctor, but a very well read, intelligent man, he I'll not get into the details because otherwise I'll be just talking about Norman Cousins. There is a video on Norman Cousins on the YouTube channel, which you were told, the Yes Spirituality YouTube channel. So there you'll get the whole story. It is after going through a stressful period. And then, he started reading about his disease himself, because the doctors told him that we don't really have any cure, but to relieve your pain, we'll give you painkillers. And he was being given very large amounts of painkillers. And he started reading about his disease and the treatment that he was getting. And he realized that the treatment was not going to actually uh, do much to go to the roots of the disease. And in fact, it might make the disease worse. Because ankylosing spondylitis, he uh, discovered, was a disease of the immune system. And the painkillers which he was being given, they deplete the adrenals of their vitamin C. And adrenals have an important role to play in immunity. And then he read Hans Selye's work of the 1950s, and found that the adrenals are important, and their function is related to the emotional emotional state of the person. So through some sort of a rough reasoning, he realized that the stress that he had gone through was responsible for ankylosing spondylitis, this autoimmune disease. And then he asked himself a simple question, which the doctors had forgotten to ask. And the question was, if stress could cause the disease, will relaxation and happiness be able to cure it? Now, doctors had forgotten to ask this because the doctors had started focusing on the body. They had forgotten the mind. They thought that you can just study the body in greater detail and do everything. Now, here, he felt that there was a relationship between the mind and the body. The stress that he had experienced recently is what was responsible for his autoimmune disease. And since the doctors didn't have much to offer, he started taking charge to some extent himself by reading about his disease, and then asked the simple question which the doctors had forgotten to ask because they had forgotten the mind body relationship. Because, the advances were such that the mind body relationship did not seem necessary. If a person has high blood sugar and you give the person insulin, the blood sugar comes down promptly. You don't need any thing on the part of the to be done on the part of the patient. The patient doesn't have to think positively. He doesn't to use the powers of his mind to bring down the blood sugar. The blood sugar will come down no matter what the person is thinking about. So we had forgotten the mind-body relationship, we the doctors, and therefore couldn't had forgotten to ask even such a question. So sometimes, lack of knowledge helps. He was not a doctor, and so he asked himself this question: if stress was responsible for this disease, will happiness and relaxation be able to cure it? So when he asked this question, he thought that why not just be happy? And since my adrenals have been depleted of vitamin C, I can make up for it by taking a lot of vitamin C. So he talked to his doctors and they said, yes, vitamin C will not do you any harm. And since we are not doing much, if you want to get discharged, you can go from the hospital. So he left the hospital. And what he started doing was started taking on his own large amounts of vitamin C, and he started watching comedies which made him laugh. And being a scientifically minded person, he started documenting the effects of the laughter. And he found a full throated laughter for about 10 minutes gave him about 2 hours of pain free existence without any painkillers. He stopped painkillers. And also, he found that that laughter not only relieved his pain, it also brought down the erythrocyte sedimentation rate. So here was something objective, which he demonstrated. And then, to cut a long story short, he went on to become a person who cured himself from his autoimmune disease, ankylosing spondylitis, from which the doctors had told him only 1 out of 500 survive. So he became 1 out of those 500 by just treating himself with laughter and vitamin C. And then, being a literary minded person, he started writing his experiences and wrote this book, Anatomy of an Illness. And then, in this, he brought out this relationship. And then, this triggered a lot of advances in medicine, and to which he contributed in any significant ways. Actually, the University of California at Los Angeles School of Medicine invited him to join on their faculty. And he became a fundraiser. He could collect so much of funds for the study of the mind body relationships, especially the effects of the mind on the immune system, that within 25 years or so, he there was enough research on in the medical colleges on the relationship between the mind and the immune system, and there emerged a new science, a new branch of science, which is psychoneuroimmunology. The name is already pretty long, so they haven't put endocrines. Otherwise, one might say psychoneuroendocrinoimmunology, which means the mind, the psyche, works through the nervous and the endocrine systems to affect the immune system. So, when a person is under chronic stress, the immune function is impaired, and a person can, when he's happy and relaxed, the immune function improves. And so it's a two-way street. Uh, it's sad that if a person is in chronic stress, immunocompetence goes down, but then one can reverse it by being cheerful and relaxed. That's research established that. So now there was a bridge now between the subjective and the objective. The psychological state is subjective, but the effects on the immune function were objective. They could be measured in a laboratory. You could uh, measure those functions and express the results in figures. You had numerical data available, and this numerical data could be analyzed statistically. So that is what the method of science is. So he could establish through this field a bridge between the psychology, which is relatively a soft area, and hardcore data, which you collect uh, scientifically, which is numerical in nature and which you can analyze statistically. So, and he has now come to be known as the father of psychoneuroimmunology. But then the sad part is that I asked many fresh graduates, even now, when they have just finished their MBBS, and I asked them, did you hear the word psychoneuroimmunology anytime in your medical curriculum? And the usual answer is no. Now, that is where we are. And we have a journal called Psychoneuroimmunology. We had the annual meeting of the Psychoneuroimmunology Research Society of the US. And this person learned about it through his own experiences in the 1960s. He came up with this book in 1979, and he wrote another book, Head First, I think that was in 1989. And uh, psychoneuroimmunology has been in around ever. A lot of research on psychoneuroimmunology started sometime in the 1990s, and within 25 years, which means at least 10 years ago, it was a well-established branch of science, and medical students don't hear even this word anytime during their medical curriculum, which is very sad. So this person established in a way a relationship between the mind and the body, and demonstrated that the mind has a profound effect on the body. Psychological changes can have physiological consequences which are relevant to health and disease. Now comes another person a few years later, Dr. D. Nornish. Norman Cousins left this world in 1990. Dr. D. Nornish is a young person born in 1953. And again, his story, personal story, is there on Yes Spirituality YouTube channel. We'll not get into that. But to cut a long story short, once again, he ended up being a cardiologist, and a cardiologist with a difference. Uh, and what was the difference? The difference was that he found that while it was known in scientific literature by then, when he was a medical student in the 1970s, that that heart disease, coronary artery disease, is closely related to diet, physical activity, smoking, drinking, and mental stress. There was no single study which had looked at all these factors together and the effect of correcting these factors on the treatment of heart disease. Heart disease was being treated primarily through drugs and surgery. Nobody bothered to give lifestyle advice to cardiac patients who had coronary artery disease. On top of that, he found that the hospitals which were treating patients with heart disease were selling hamburgers and things like that, and cigarettes, hamburgers and cigarettes in their lobbies. So, being a person who had by then some background in yoga and a very comprehensive view of yoga, not just physical practices, he thought here is a total change in lifestyle which is possible through yoga. So he started doing studies on yoga in coronary artery disease patients. And what did his peer group say? The other doctors say? First, they said this is not possible. They started punching holes into the studies that he had done. So he did more and more careful studies. And finally, I think around 1990, a landmark paper was published in Lancet, which was a controlled experiment in which there were uh, those who got only conventional treatment and those who got, there were two groups, comparable in severity, around 50% block of the coronary arteries. Where the control group got only conventional treatment, the experimental group got conventional treatment plus a yogic intervention, which included a total lifestyle change. So initially, the other doctors were skeptical. There are some probably flaws in the study. Then, when the results became more and more convincing, they said probably it is because of the diet, probably it is because the patients give up smoking. Nobody was prepared to believe that the patient's stress being relieved, the patient being a happier person now, had anything to do with recovery from disease. So, mind body relationship is something which still people are not believing in, although psychoneuroimmunology was already growing. But that time when it was just growing in the 1970s. But by and large, that's what the peer group Salito in California. Although he, no matter how much data he generated, his approach did not become mainstream. We'll not get into why it did not become mainstream. And the patients probably thought that taking a pill or getting surgery done is much more convenient than making of reasons why they did not want to encourage this approach. And therefore, although he generated a lot of data, even after that Lancet paper, there was another follow-up of the patients in JAMA in 1995. So he generated start believing him and approach will become mainstream. But so then he thought of another approach. What he did was he contacted the medical insurance companies. It was in their interest to reimburse his program because they were not reimbursing his program. He showed them that this costs much less than surgery. So instead of that, if people do this, you will have to give much less reimbursement. So when they because it was much cheaper than a hospital. And that's where he used to give a 5-day program of lifestyle modification. And this program now was being reimbursed by medical insurance companies. That is what made his program popular and made him make his living by just offering that type of programs. So he's a cardiologist with a difference who brought yoga in and in a holistic way, not just the physical practices, but also a change in the diet and giving up smoking and a psychosocial intervention to take care of the stress of the person. And he has ended up writing his approach may not have become mainstream, but he has ended up writing two very popular paperbacks. Dr. Dean Ornish's program for reversing heart disease, which is particularly about heart disease, and a general one on love and survival. That is how much survival depends upon love in the person's life. Because love is the key to happiness. So in a way, one can say that it was through the emergence of diseases like heart disease and diabetes and so on, which were the new uh, killers of mankind, which emerged after life expectancy increased as a result of advances in physical medicine, that we rediscovered yoga, because it was found that those lifestyle diseases were the result of a of a change in the lifestyle, a faulty lifestyle, and mental stress. And therefore, there started this search for healthier lifestyles and better ways of reducing stress. And both these explorations converged on the rediscovery of ancient disciplines like yoga. And in that, Dean Ornish was a pioneer. And that's how yoga got established once again in the medicine as an integral part of modern medicine for treating heart disease. But then, not only his peer group in the US uh, made all types of excuses for not believing in him or attributing whatever little truth was there in his studies, attributing it to physical factors like diet and exercise and so on instead of the psychological factors. What was the reception he got when he came to India? In his book, Reversing Heart Disease, which is partly autobiographical as these books end up being, he talks about his experience at the All India Institute of Medical Sciences in New Delhi soon after he had started this yogic intervention in heart disease. And he said when he was speaking to the physicians of AIMS New Delhi about yoga, the impression he got from those physicians was as if they were embarrassed because Dr. Dean Ornish was talking about their stepchild. Not stepchild, illegitimate, sorry. It was worse than that. As if Dean Ornish was talking about their illegitimate child. That's how the physicians seemed to look at yoga as in the 1970s and 80s. Now he come to and yet another doctor in the US, Dr. Bernie Siegel, born in 1932. He's now 92. Now, initially, when he graduated in medicine, he in fact started feeling that he had entered the wrong profession. He had entered with the hope that he'll be able to help a lot of patients, and he found there was not much really that we were actually doing substantially for the patients, and he started thinking in terms of a change in career. Every doctor more or less feels that when you just finish graduating, you have high hopes as if modern medicine will give you the key to the people's health problems related to health, and you'll be doing a lot of service to humanity by relieving them of their disease. But then you realize that the situations in which the patient recovers, your contribution was very little, and when the disease was incurable, modern medicine could not do much. So that's the type of impression he also got, and he was thinking of changing his career. Before he got exposed to some such sessions, they were actually on imagery, where he found that the mind-body relationship could be exploited to help patients. So he decided to be a doctor with a difference. And he did turn out to be a doctor with a tremendous amount of difference. He finally ended up being a cancer surgeon. And then he found that the people by and large die of cancer no matter what you do, but there are some patients, exceptional patients, who recover completely. their cancer is cured. And he found that in those cases, the diagnosis is not wrong, the cancer is not mild, and yet they recover because they are different type of people. They are people who do not uh, believe the doctor. If the doctor says that with this type of cancer at this stage, probably you live not more than a year, they say, well, the doctor is not God, I'll prove him wrong. So you have that fighting spirit. Secondly, they don't focus on the disease. Uh, they say, well, maybe I will not live very long. I have got advance notice, which is good. So now I'll do all those things which I had been postponing so far. Here's an opportunity. So they make their wish list of the things that they really wanted to do but had been postponing, and they start going about doing those rather than focusing on disease and death. Even more important, the third characteristic which these patients had was that they did not even focus on themselves. We felt that, well, now that I may not live very long, why not become a better person? So they started making amends with those with whom they had differences. If somebody had hurt them, they forgave that person. If they had hurt somebody, they apologized, and they became much more loving, caring, much more willing to share. They became different type of people. And when they did that, it seems that they seemed to be helping themselves. These were the people who recovered from cancer completely. And now that we look back in terms of psychoneuroimmunology, we find that it happened because no matter how well the surgeon does the surgery, there'll be always a few cancer cells left behind in the body, which will be lurking here and there. And these cells then have to be taken care of by the immune system of the body. We know that immunological surveillance helps also deal with cancer cells. So the cancer cells which is cancer surgeon leaves behind will be taken care of by the immune system of the body. So if the immune system is strong, those cells can be taken care of completely and the person can recover. And on the other hand, if the immune system is weak, probably these remaining cancer cells will actually lead to a metastasis because then they'll spread throughout the body. Because these cells which have been released during surgery and because of manipulation of the tumor and these cells lying here and there, and they will start circulating and will lead to metastasis, and that's how the patient will die after a few years. But then if the immune system is strong, the tumor load has been brought down by the surgeon, but still a few cancer cells are left in the body. These can be taken care of by the immune system of the body. Now, Bernie Siegel argued that if this is a type of attitude that comes to some people naturally, can we induce it in others? And he found that it can be done because although attitudes don't change very easily, but when a person is diagnosed with a disease like cancer, the change in attitude is relatively easy. So these were the people whom we called exceptional cancer patients. And uh, he became one of those people who uh, now felt that, well, everybody doesn't have to die of cancer. And he attributes this, gives credit to those few patients who survived. And he says that sometimes, doctors tend to dismiss these freak cases as exceptions. Well, exceptions can't become the rule, they just ignore these cases. But then he says that we can maybe learn something from these people, these exceptional people, and that's what he did. Why not learn what is it that makes them respond to the disease differently, instead of dismissing them as cases which cannot become the norm? As he says, let anecdotes not get killed by statistics. And this is something which is not new. It was a rediscovery again, like yoga. Because here is Hippocrates who said in 400 BC, it is more important to know what sort of person has a disease than to know what sort of disease a person has. We forgot all this because of advances in physical medicine. But then still, what does his peer group say? And continues to say. I met him last year, and he says that the peer group considers him an eccentric doctor, a crazy doctor. That's how he's looked upon as. But then that has not stopped him from writing some bestsellers. Again, two well-researched paperbacks for popular consumption, Love, Medicine and Miracles, and Peace, Love and Healing, and many more. And he sums up that for the best outcome, four crucial faiths are important. Faith in oneself. That is, the patient should believe that I can heal myself. I have self-healing capacity in my body. Resign. Faith in the doctor to whom he has gone. faith in the treatment that he's getting, and spiritual faith. Now, where does spiritual faith come in? We have talked only about the mind body relationship. That we'll see as we go along. By the way, Bernie Siegel is a deeply spiritual person. Now, what we have seen is basically the mind-body relationship so far, which means that just by studying the bulb, we will not understand all the secrets of the bulb. We also have to know where the switch is. So mind is like that switch. So unless you know the relationship between the switch and the bulb, you can't really understand the bulb and make the bulb light up. Light up or go turn it off at will. You can't do that unless you. But then the switch alone is not enough. The switch also has to be connected to the wires, and there has to be a flow of electricity. And roughly, if one may say, it is that those relatively invisible wires and electricity, which is what the spiritual element is. And the mind-body relationship has been again well known. It's also a part of folk knowledge. It's a part of everyday observations. It is when the child has examination coming that the child is more likely to catch a cold. And here's is what the mother said. Uh, Establish a greater peace and quietness in your body that will give you the strength to resist attacks of illness. Much before we had psychoneuroimmunology, spiritual people knew it. So mind-body medicine is basically the power of the patient's mind, which can be used for healing the patient's body. But then the mind needs an anchor, because if the mind is not at peace, how will the mind be able, person will be able to, how will the person be able to use the powers of the mind to heal the body? And the mind needs an anchor because the emotions are by very nature volatile and the intellect is vacillating. These are the two major parts of the mind, feeling and thinking. So the feelings or the emotional part of the mind is highly volatile, seldom at rest. It's like a you know chip on a stormy ocean, and the intellect is vacillating, seldom sure of anything. So it needs an anchor. And what is that anchor? The anchor is the soul. The soul is our divine essence. It is hidden, but it can manifest. It can manifest much more than it normally does. How? We'll not get into too much detail, but we'll get some glimpse of it today. Now enters yet another doctor. Again, another doctor in the US, Dr. Larry Dossey. Now, while he was still a medical student, he accidentally came across some study which talked about the relationship between prayer and healing. And then he thought that maybe it is something unscientific. That's why I'm not being taught anything like this in medical school. But then he was not at peace. He was, a, again, a spiritually inclined person. So he uh, did some more search. He searched up medical literature and found that he could find about 100 studies done at different periods of time on the relationship between prayer and healing. Many of them seem to satisfy reasonably well the criteria of science and showed some positive effects of prayer. And the conclusion he came to was that not to employ prayer with my patients would amount to denying them a potent therapeutic tool. So he started praying for his patients and started advising patients to pray. But then he was careful. He said that I told them to pray, but I didn't tell them how to pray because that should be left to the person. That's an individual choice. So doctors should not use the power that they have or the influence that they have on patients to influence the way the patient prays. But then he was not shy of uh, telling them that prayer will help, because he said not to employ this power will be denying them a potent therapeutic tool. And then, of course, he got uh, more and more inclined to it. More studies were done, and he collected those studies to publish again paperbacks and so on. But then another thing that he started getting into goes even beyond this. Who should pray? The patient prays and the patient gets better. Maybe it is the mind body relationship of the patient at work. The patient thinks that I am praying and therefore I'm getting better. But how about the doctor praying? Can that also help? Or to say, put it in more neutral terms, can the healing intentions of the healer affect the patient? The prayer is essentially healing intention. Leave aside the uh, part of the divine or the creator and so on. Even if you leave that out, it is the healing intention of a person affecting the healer. Now that is easy to explain in spiritual terms, and those who know theoretical physics at a level which I don't, they say that there are alternative explanations available also in theoretical physics to explain the same phenomenon. Now, spiritually speaking, there is a continuum of consciousness because all creation is a manifestation or a visible form or a concrete form of the same divine, the same supreme consciousness, which we call God. So the patient's body is a manifestation of that, and the doctor's mind is also a manifestation of the same, and the air gap that separates them is also a manifestation of the same divine. So these are all different modes of consciousness. So why can't, if there's no breach in the continuity, why can't one mode of consciousness influence another mode of consciousness? So the healer's mind, which is one mode of expression, one mode of manifestation of that consciousness, can affect the patient's body, which is another manifestation of the same consciousness, and the two are connected through a medium which also is a manifestation of the same consciousness. So there's no real breach of continuity, and that is how this effect can happen. And here is Sri Aurobindo on this, that all exists in an infinite conscious existence and is a part or a form of it. All things are inhabited by this consciousness, even the things that seem to us inconscient, and the consciousness in one form can communicate with or contact the consciousness in another, or else penetrate or contain or identify with it. So these are the key words. You see, the consciousness is one form, can communicate with or contact the consciousness in another. So that is what is responsible for this effect. And this effect can take place across distances, long distances. The person doesn't necessarily have to be a doctor. And the transmission, since it is taking place through a field of consciousness, does not really require a physical medium. And the transmission is instantaneous, unmitigated. That is, it does not really reduce with distance. And that is the type of effect which is possible. And this explains many types of healing and systems of medicine: faith healing, distance healing, and systems of medicine like pranic healing and Reiki and so on, which essentially are an effect of the healing intentions of the healer on the patient. Now, Larry Dossey has was tried to sort of bring into prominence in modern medicine the effects of prayer, has talked about three different periods in modern medicine. He calls the period from 1860 to 1950 as era one, which was the era of physical medicine. It was during this period that physical medicine made spectacular advances and led to a remarkable increase in life expectancy. Era two, from 1950 onwards, he calls the era of mind body medicine. But then he has predicted that there will be an era three, for which in his books he put the date roughly around 1990, which will be the era of non-local medicine. Non-local means that it does not require the doctor and the patient to be at the same place, and the effects are non-local in nature, because this is the type of this thing that was talking about in physics. This is the effect, is non-locality. The concept is called non-locality. So to use a scientific and neutral term, he has called this era 3 as non-local medicine, which means that this will become also a part of modern medicine. So he says that every advance does not mean that the advances of the previous era are being neglected or rejected. We are only adding a new dimension to modern medicine, expanding the armamentarium. And he has talked about some very interesting ways in which non-local medicine might develop uh, in a formal and systematic way. He says that what he can visualize is that the hospitals, just as they have lists of people who are blood donors. So, when they need blood, they contact those people and ask them whether they're willing to come and give blood for a particular patient. They know the blood groups, and especially in case of rare groups, they start contacting the patients because they already have those lists. In the same way, hospitals will start maintaining lists of people who are willing to pray for patients. So when a person comes to the emergency, they'll not only think of uh, if the person needs blood, contacting the blood donor volunteers, they'll also start contacting those who are willing to pray and tell them that this type of patient has come to the hospital, please pray for him. So that is the type of interesting things he has visualized would happen when this non-local medicine becomes part of a properly established part of modern medicine. Then, as I was saying, that essentially it all boils down to love again. And this is a very nice quote from him. If scientists suddenly discovered a drug that was as powerful as love in creating health, it would be heralded as a medical breakthrough and marketed overnight, especially if it had as few side effects and was as inexpensive as love. And here are again some beautiful paperbacks that Larry Dossey has written. Prayer is good medicine, healing words, reinventing medicine, and then be careful what you pray for, you just might get it. And there are many more. And here is Sri Aurobindo on the same lines. Unappalled by the fear of death, whence thou leave to him, that is God, not as an experiment, with a calm and entire faith, thy ailments, thou shalt find that in the end he exceeds the skill of 1,000,000 doctors. Because God is also within us. And it's just the expression is imperfect and partial. If we can increase that expression, which is possible, partly through faith, but then there are other things that may be required. But at the same time, it is possible for that expression of the divine within us to be increased. And as that increases, one can find that eventually the skills of the divine within exceed those of 1,000,000 doctors. But then this has to be done with faith, not as an experiment. Well, might as well try this also. Maybe it will help. Not with that type of an approach. That's a conditional experimental approach. So the doctor is in, but for the doctor to work, the doctor that is in to work, it needs peace to do her best. So the actuality that is there is much less than the potentiality. The extent to which we actually use this doctor within is much less than its potential. And that is because any barrier between the surface is the body and the mind, and the source is the soul. And the soul is a spark of the divine, which is the source of everything that exists. So any barrier between the surface and the source diminishes us. It diminishes the possibilities of the source working in us. But then we have, in a way, traveled full circle. Uh, if you go to Ayurveda, you find that Ayurveda was not a science of physical medicine, it was a science of spiritual medicine. Uh, Here's a quote from Charak Samhita, one of the classics of Ayurveda, that life is the combination of body, senses, and mind, and reincarnating soul. So the soul has not been neglected, the soul has been taken into account by this system of medicine. Ayurveda is the most sacred science of life. And here is David Frawley, a Vedic scholar who has also studied Ayurveda. He's again an American, and he has written many books. One of them is Yoga and Ayurveda. And in that, he says Yoga and Ayurveda are closely related spiritual or sacred sciences rooted in the Vedic tradition of India. And he has compared them in a very simple way. Yoga is basically a science of self realization, whereas Ayurveda is science of self healing. But the two are closely related because both are looking at the whole person. And the whole person in yoga is the same as the whole person in Ayurveda. the person includes not just the body and the mind, but also the soul. In fact, one can't say that the soul is the third component, body number one, mind number two, and soul number three. Soul is the essence of the person. Soul is the divine essence of the person. The body and the mind are surface manifestations of the hidden divinity. So that is, in fact, central. The soul is the central factor, and the less the barrier between the soul and the surface, which in turn is a spark of the source of everything around, the greater will be the potential in for self-realization as well as for self-healing. But then, because of the advances in modern medicine, uh, we have got so we started feeling that recovery is possible only through drugs or medical intervention. And because of we have developed this habit, Sri Aurobindo says here, it should take long for self-cure to replace medicine because of the fear, self-distrust, and unnatural physical reliance on drugs, which medical science has taught to our minds and bodies and made our second nature. Here are two YouTube channels which you could subscribe to. One is Sri Aurobindo Ashram Delhi branch YouTube channel, and the other is Yes Spirituality YouTube channel. It is in the Yes Spirituality YouTube channel that you have those 70 videos which were talked about in the introduction. They are all in a single playlist, well organized. The playlist is Scientific Medicine, a Wide Angle View, and it gives you a overview of from top to bottom. There's a seamless blend of basic sciences and clinical sciences, modern medicine, Ayurveda, and spirituality. And they're arranged in such a way that if you go in that sequence, you get a good mastery of the that particular part of the body. For example, in case of immunology, the video on blood, the video on immune system, and the video on Norman Cousins, who is the father of psychoneuroimmunology. They are from one cluster. In case of heart, uh, two videos on the um, structure and function of the cardiovascular system in health and disease are followed by a video on coronary artery disease, a video on hypertension, and a video which talks about Dean Ornish, like a story. How is it that being a person trained in modern medicine, he ended up being a cardiologist with a difference. So that, is because of, it's all related to the personal history of the person. It doesn't happen by magic. So all that emerges from those. So they are placed in such a way that in a cluster that you can see those like chapters in a book, 70 videos covering the entire body.
Yeah.
So yes, the doctor is in, and thank you for patient listening.
Yeah, thank you, sir, for
Uh,
wonderful talk and taking us on this journey of the doctor is in and guiding us about psychoneuroimmunology.
Very
So,
nice.
yeah, it
Excellent.
is excellent talk.
Excellent talk.
So, now I take the opportunity to invite Dr. Rajvi. Madam is here with us.
Any questions you can, anybody, any questions?
Yeah, the questions can be
Because in
taken
the
up. You
chat
can put in
box,
the chat box. Yeah,
yeah.
meantime, I'll request Dr. Rajvi. She's although into IVF, but that's another part is that she's a very spiritual person. And as I mentioned, she herself is a Iyengar into yoga. And she's also a researcher and a speaker in many international conferences. And apart from that, she's convener of IFS SIT on holistic medicine also. So I request Dr. Rajvi to please give your closing remarks.
So, firstly, thank you, Dr. Bijlani. It was a fascinating talk. It's nice to see you after a long time. Like you rightly said, we've met at a couple of
You
conferences
could-
and meetings, but it's nice. It's very, very fascinating that you talked about, you literally covered the history of medicine in a way. And I think the biggest time of medicine was when we identified deficiencies and found supplements. diseases and infections and found vaccines and antibiotics. And I think, in a way, the ego of that group of practitioners and medical practitioners per se became so high that we became dogmatic that, we could enhance human longevity. And that is the reason we have subdued all the other aspects of the human being. I mean, you talked about those three great people, Norman Cousins, psychoneuroimmunology, Dean Ornish, and cardiology, and Dr. Burney and his, all the stories about cancer. But the fact remains that, their books became bestsellers and still are read. But on the other hand, the peers refuse to accept him. So it's time that, we realize that if modern medicine alone could cure everything, then no doctor would fall sick. So it's time we realize that we go back to the holistic approach. It's not saying this or this, it's all together. And I think you brought it out beautifully and just brought back memory of when you talked about cancer. I have a friend about whom I've written in my book who has had 5 relapses of cancer in span of 25 years from the age of 25 to 50. And she just says, why are you giving it so much importance? It's part of life. It is not life. The whole attitude. And when somebody said it's a disease, it's like cold, why are you making it so big? And you brought all that out beautifully in your talk also, what Dr. Burney was saying. And I didn't know there was a pattern to people. I just thought this was one odd case. But if that is a pattern and we can, help out, like he said, if that attitude can be created. And I think that's where yoga comes in, because the practice of yoga brings down our desires, brings in more contentment. Then, and automatically you are, happier. And if you're happier or not sad, naturally you can handle disease well. And I would just like to end with a quote of my Guru Yogacharya B.K. Iyengar, that yoga cures what need not be endured and endure what cannot be cured. So it's not that life is going to be immortal, but at least we can life fully. And yes, I'm
Just
definitely
excuse
going
me,
to yes to talk to you. So thank
Rajvi,
you.
one question to Dr. Bijlani. Just one question to Dr. Bijlani
Yeah.
before we end. Is it okay, Leena? Dr.
Yes,
Leena?
yes, madam. Yes, yes, madam.
Dr. Bijlani, can we? Because
Yes,
we are well in time. Sir,
yes, please go ahead.
see, you said these were few things you said, that soul is the divine essence of a person, right? And you said the expression of divine has to be increased. So can you tell us which way do you think that will help to express your divine uh, inside itself? Like, is it only through yoga, or maybe bhakti yoga, or what do you think is the way to give the expression of divine?
Well, the uh, yoga, in fact, all yoga is about expressing this divinity to a greater extent. Uh, that is what the path of yoga is about. The paths can be many, but the goal is the same. The goal is to express more and more of the hidden divinity. And uh, it's not that only one path can be used, you can use a combination of paths also. Uh, and the Gita is a good example of a synthesis of action, knowledge, and devotion. Uh, but then uh, Sri Aurobindo's integral yoga not only takes into account the yoga of the Gita, but also incorporates Hatha yoga and Raja yoga. So all that can be integrated. And eventually what happens is in Sri Aurobindo's integral yoga, all life becomes yoga. Now, when we say all life becomes yoga, essentially, if one were to put it very simply, the techniques do find a place, because techniques don't find much of a space in the Gita, except a little bit on meditation. But in integral yoga, the techniques do find a place, asanas, pranayama, meditation, but primarily in moderation, to the extent the person can do for improving the instruments. The body and the mind are instruments. So the techniques find a place for improving the instruments, but then the instruments also have to be used in everyday life. So how we use the instruments, for that guidance is also available in yoga. So yoga becomes a combination of the yogic techniques for improving the performance of the instruments and the guidance for how to use those instruments. And how we use those instruments finds a place in the work that we do, in the spirit of karma yoga. it finds a place in the way we make choices. Choices can be made at the level of the emotional part of the being, the intellect, or the soul. So it is the soul that gives us the most authentic choices. So you start making choices more and more at the level of the soul. And it finds an expression also in the way we respond to ups and downs of life. So, as Rajvi said just now, that it's not that we always get cured, but we can deal with what cannot be cured.
Yes,
Because
yes,
having a disease is one thing, being miserable because of the disease is another. So,
yes.
doesn't mean that if one has a disease, one also has to be miserable. Not only that, one can also understand the proper way to die. That also, so yoga works all the way from uh, promotion of positive health up to how to die and everything in between the two. So yoga deals with all that. So which means that how we deal with the ups and downs of life, all ups and downs, fortune, misfortune, because no matter how we live, it does not make us immune to a financial loss or litigation or poor health or poor interpersonal relationships. We still remain vulnerable in many ways, but how we respond to them, that is up to us. And for that, again, yoga helps us in not only staying calm, but also in using even the so-called misfortunes as opportunities for spiritual growth. So which means now if you uh, uh, work in the spirit of karma yoga and make choices at the level of the soul whenever choices have to be made, and respond to ups and downs according to the guidance provided by yoga, all life is covered. What else is there in life except the work that we do, the choices that we make, and the way we respond to ups and downs? So all life is covered. So that's how all life becomes yoga. So 2 hours a day, say techniques for improving the instrument, 22 hours a day, the guidance available in yoga for using the instruments. So that makes all life yoga. And that is how we end up expressing more and more of the divinity hidden within.
Mm. Yeah.
And to sort of be able to be aware of that divinity constantly and make life revolve completely around it is more than a lifetime's job.
Yes.
That's why we
Yes.
need to continue the journey from life to life. But
Yes.
same time doesn't mean that if it is so long, why embark on it? Because every step that we take on that journey, even the part of the journey that we cover, helps us in this life being happier and healthier. It helps us after we leave this world in finding a better place in the other worlds. And it helps us when we again get embodied, the soul gets embodied again, we return to more favorable circumstances, as the Gita has assured us that
Absolutely.
that
Absolutely.
it's never a waste. You come back with those tendencies and get born in a suitable family so that you can continue the journey further.
Excellent. Excellent. This is a very nice. And one more
But
thing, uh, you said, see, doctors needs peace, and doctors emotion is also very important, that healing uh, purpose of the patient, like, whenever doctor is taking the decision from the soul in a karma yoga, he's doing the karma, but when doing the karma also, if you starts getting into the soul, like, doctor should not be only a body doctor, but it has to be body and soul. It is not only the body which responds, but in the body there is a soul. So, in this situation, right now, current scenario, if you see, doctors are much, much bothered about these litigations, continuous litigations in the mind, hanging around. So, I think probably if they should be in the peace to give the best to the patient and the best outcome. So, this is what I usually used to tell, that, doctors, especially a medical profession, should not be bothered about, or they should not be pressurized for the litigation. Of course, they should be responsible. I'm not saying that they should not be responsible, but this too much of a litigation botheration has made us to go in a different way altogether. So this is what I felt, and this will help to understand the doctor is in now. Whatever you said today's was very nice.
Yeah, it was
Yeah.
an excellent talk. So it's now
Yeah.
time to conclude the session. And thank you, sir, for taking us through this transformative journey. And we look forward also to connect with you in future also, sir. And it is very important for all of us to create awareness about such self-empowerment programs And the recording of this today's online module will also be available on the website of Indian Fertility Society. You can go through the YouTube channel. So with this, I would like to thank everyone, and I'd like to close the session. Thank you,
Thank
everyone.
you. Wait for the next one.
Yeah. Okay.
Bye. Thank you.
Okay,
Good
bye-bye.
night.
Thank you. Good night.